Hello, good people. How are you? Hope you're fine. So, have you been asking yourself, when do we do secondary assessment and how often do we do it? Yes, secondary assessment is oftenly done when we are fully done with primary assessment. Secondly, when we have addressed all the life-threatening conditions or any issues that our patient has been having, and then when the patient is stable enough, that's when we do our secondary assessment. And today, let's break down what entails into our secondary assessment. Usually, our secondary assessment, we have an acronym that we basically use to smoothen the process, to make it easy for us to do our work. So we have an acronym known as SAMPLE. SAMPLE. S stands for signs and symptoms that the patient is presenting with at that particular moment. The S stands for any allergies. Is the patient allergic to any medication, any food substances, things like that? Then the M stands for medications. Is the patient taking any medications at that particular moment, or is he or she taking any medicines? Yes, you need to do that. Then the P stands for the past medical or surgical history. Has the patient had any surgical operation done on them? Any medications that they've been on in the past? So the L starts for the last meals. What is that one thing that your patient last ate? Is it a burger? Did they last take a cup of milk tea? Things like that. Then the E stands for events that precede the event or the injury that has occurred. Yes, any events leading to the event that has occurred, like the patient is presenting with apparently. So then some other thing, you're supposed to do your investigations. As per the patient's presentation, you're supposed to run your investigations. You have to take the baseline observations, your TR BP, your temperature, respiratory rate, the blood pressure, such things. You assess the pain score using the pain scoring. We have so many pain scoring skills that we can use. You assess for pain, so things like that. Yes, hope you've got that. When do we do a secondary assessment? How often do we do it? And then what entails into the secondary assessment? Yes, hope that really helps. Have a good time. Bye bye for now.